Well, thank you, Sylvie, and good morning, everyone. It is, in fact, great to be here at the College of Nurses of Ontario to talk about how our government is making it easier and more convenient for Ontarians to connect to care. Thank you to the CNO for hosting me today. And on behalf of Premier Ford and our entire government, I also want to express my sincere appreciation to all our incredible nurses and nursing partners across Ontario for everything you do to provide exceptional care to patients and families each and every day. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Our plan is called Your Health, and it's focused on building a healthcare system that puts patients at its heart by connecting Ontarians to more convenient care options closer to home, while shortening wait times for key services and growing healthcare workforce for years to come. Over the last year, our government has taken bold and innovative action to support and grow our nursing workforce to provide patients with a better, more connected healthcare experience. We have worked with the College of Nurses to break down barriers for internationally educated nurses, making it easier and faster to register in Ontario. And with our new as of right rules, we have made it possible for nurses registered in other Canadian provinces and territories to immediately start working here in Ontario. With our plan, we saw a record-breaking year with over 15,000 new nurses registered to work in Ontario, with another 30,000 nursing students currently studying at Ontario colleges and universities. To support nurses currently in the profession, our government has invested $14 million to support 600 nurses to upskill their training to work in critical areas of hospitals. And earlier this summer, we announced the Clinical Preceptor Program that pairs experienced frontline nurses with new grads, internationally educated nurses, or those looking to upskill and ensure they have the support they need. Today, as part of our Your Health plan, I am pleased to announce that our government is taking another step to make it easier and more convenient to connect people to the care they need by expanding the role of registered nurses to prescribe medications for certain conditions in a variety of convenient settings in your community. With these changes, registered nurses that complete additional training will be able to independently provide people with birth control, drugs for smoking cessation, travel medications to treat and prevent diseases like malaria, topical wound care, and vaccinations such as the flu shot and COVID-19 vaccine. Starting in January of 2024, training will open for registered nurses interested in completing additional certification. Training programs are being developed by the College of Nurses of Ontario to ensure registered nurses can acquire the knowledge, skill, and judgment to conveniently administer and prescribe more medications. Ontario is proud to be home to world-class healthcare workers, and that's why we are making it easier for healthcare professionals to work to the full extent of their training and expertise, while providing people with more convenient access to care closer to home. Our government will continue to take decisive action to build a healthcare system focused on meeting the needs and priorities of Ontarians, and we will continue to work collaboratively with our health and community partners to implement creative and innovative approaches that provide more connected and convenient care for patients when and where they need it. Thank you. Stay well.
Okay, we're ready to take questions at the mic. Just a reminder, it's one question, one follow-up.
Hi, good morning. It's Jessica Smith-Cross from the Trillium. Your office recently gave us a statement after there was some controversy over a clinic in Ottawa that was planning to charge patients for access to nurse practitioner services. You said you were planning to close that loophole, was the statement we were given. Have you taken any action towards that goal, and if so, what?
Yes, we have ministry officials who are actively working and talking with the clinic to see what they were proposing, getting those answers back. And as we get those answers, we will make the next determination of what we have to do.
Okay, to follow up on that, overall, are there any plans coming from the government to ensure that when patients get these services from nurse practitioners or these new expanded services from registered nurses, that they are not going to be made to pay for access to that care?
Absolutely. As we expand scope of practice, we want to be very clear, and we have been very clear, that all of these expanded scope of practices ensure that you continue to use your OHIP card. You know, I point to an expanded scope of practice that we announced in January of this year in pharmacies in particular. Over 400,000 Ontarians have used that service, all within their OHIP-funded services using their OHIP card.
Jean-Loup with Radio-Canada. Good morning. A study in the Canadian Medical Association Journal today looked at the use of virtual urgent care during the pandemic and concluded it didn't really divert anybody from going to the ER with serious injuries. So what's your assessment of those pilot programs?
So, as you know, during COVID, when we wanted to ensure that patients who needed access to their primary care practitioner had that option available, which is why we did a special one-time process, pilot if you would, with the Ontario Medical Association. As you know, there has been a pause on that while we negotiate with the Ontario Medical Association. I will say that there is absolutely a place for virtual care. What we need to work with from the clinicians and the OMA standpoint is making sure that we know exactly which of those services are most appropriate and can continue to be provided effectively through virtual care, and which ones, frankly, are more important that you get in front of a primary care practitioner.
And as you know, in the last couple of weeks, there's been a number of cyber attacks on hospitals, southwestern Ontario notably. What's the ministry learning from these attacks and doing to prevent it in the future?
Yes, so the OPP are investigating the particular cyber attack that you're referencing. Without a doubt, we are very concerned when any type of patient access is compromised, and we continue to support those hospitals to make sure that as they work through finding out exactly where the breach was and working with ensuring that that doesn't happen again, understanding and appreciating that the OPP investigation is separate and apart, we will continue to work with those hospital partners.
Minister Alison Jones with Canadian Press. Last year in your, I believe it was in the plan to stay open, you talked about stabilizing nursing agency fees, and it said you were going to take a look at them as it relates to hospitals, long-term care, those types of institutions. What kind of work has been done on that since then, and is regulating the fees or licensing those agencies on the table at all?
Yeah, so, you know, the Premier often says you can't manage what you don't measure. So one of the first things we did was to establish and try to figure out just how much nursing agencies and manpower agencies are being utilized in our healthcare system. In fact, what we have seen is a decrease in the percentage of usage. Having said that, we want to make sure that as we continue to expand our supply, as we continue to license more nurses in the province of Ontario, like we did last year, record number, as we continue to work with colleges and universities to make sure that they expand their pathways to education, we have to stabilize that demand. And I do know, and I hear from hospital leadership and from long-term care, that there is a need from time to time to use these personnel agencies to deal with surges. I don't want to take that tool away from them, particularly when I see the percentage of use going down as we continue to expand the number of nurses who are actually practicing in Ontario.
Does that mean that you think that regulating the fees or licensing the agencies would somehow take that tool away from them?
I think that we have seen in other jurisdictions when that has been attempted, it has destabilized the system. I don't want to destabilize the system right now. I want to expand access for internationally trained nurses and other healthcare practitioners to be able to quickly get assessed, reviewed, and ultimately licensed if appropriate. And I'll continue to make sure that we expand our supply because we see a growing population and a population that, frankly, needs to have more access to primary care in Ontario.
Just want to ask for a quick little update also. You mentioned birth control as one of the things that RNs could now prescribe. You had said, I think, earlier this year that you were looking at what BC has done in terms of covering prescription contraception. Are there any updates there? Is that still under consideration?
So we actually had a federal, provincial, territorial meeting of health ministers a number of weeks ago, and it is very gratifying to see and hear from other health ministers and learn what they are doing in their jurisdictions. And I have to say that Ontario truly is leading the way. You know, I just talked about primary care expansion. We have the most amount of attached patients in the province of Ontario. It's over 90%. I want to keep growing that number, but we do lead Canada in many of these initiatives. And I'll continue to work with, whether it's Minister Dix in British Columbia or others, to see where are the pressures, where are the opportunities that we can use and better utilize the staff that we currently have in our system. That's exactly why things like scope of practice changes are very much in discussion with all of our regulatory colleges.
Good morning, Minister. It's Craig Wadman with City News, and I'm just reading this on behalf of my colleague. So we've been speaking to a mother who's got a child with complex special needs, and she's saying that because of Bill 60, that most of the ICU level trained nurses that she's coming across have left home care due to the low wages and opportunities that are maybe more attractive with private clinics. How will you ensure that Bill 60 doesn't worsen the staffing shortages in home care and public hospitals?
So first of all, as it relates to home and community care, of course, our government, under the leadership of Minister Bethlenfalvy, announced a $1 billion investment in home and community care. We have stabilized through wage enhancements to make sure that we don't have this constant back and forth of you're getting higher compensation when you are in hospital long-term care as compared to home and community care. So we've done that stabilization piece, and now we are working very much with the sector on making sure that there is a consistent approach in what you can expect when you have home and community care. That work is happening right now through legislation that is actually up for public comment as we speak. And I want to see a home and community care sector that has as much provincial support to ensure that when individuals want to and have the ability to rehabilitate or be at home in their communities, we're there for that. And that's the $1 billion investment that we made in the most recent budget.
Thanks for the opportunity to ask for another question. It's Jessica again from the Trillium. Recently, we spoke with Associate Minister Michael Tobolo about the shooting outside of the consumption and treatment services site in Leslieville. He said that there was a review of the framework for all of the sites ongoing, and that no new sites would be approved in the interim. Can we get an update on when that review is expected to be done and what is on the table that may be changed because of this shooting?
So we've been very clear that all consumption and treatment sites must adhere to the contracts that were signed and prepared for them. We are doing a particular review on the Riverside site because, frankly, that was a devastating impact. And we want to make sure that if there are additional things that should be embedded in future agreements, we take the time to do it right. That's why we've put a pause on any future expansion. We want to see the status of the ones that are out there and operating now. And we also want to say, is there anything else that we need to look at to make sure that communities are as safe as the patients and individuals that are being served?
To follow up on that, there are some sites, particularly in the north, that have been running on municipal funding that is going to be out by the end of the year. Will you be done by then in a position to authorize them to get provincial funding by the end of the year?
I believe that this is an important enough issue that we need to be very careful and strategic in terms of what do we do in terms of next steps. I think that individual sites that went ahead with federal approval, not having any provincial funding, need to make their own determinations locally what they want to do. But I'm not going to rush this process because it's too important. It's too important for community, and it's too important for the staff that are working on those sites.
Thanks, everyone.